Hi, my name is Jim Krause, and I am an Associate Dean at the Medical University of South Carolina. And I'm going to be doing a presentation today, a study of quality employment outcomes among individuals with multiple sclerosis. I have two co-authors, Melinda Jarnicki and Carla Reed, who are not here today. And this work is part of the Health, Employment, and Longevity project that we are doing at the Medical University. And I will talk about that during the presentation. I'm also probably going to take a couple of brief breaks for getting a little water while I do the presentation, so expect a couple of pauses. I'm also going to go slide by slide and try to make this as interesting as possible. Next. So the information from this study was developed for the Rehabilitation Research and Training Center on employment of people with physical disabilities at Virginia Commonwealth University. The contents of the presentation were developed under a grant from the National Institute on Disability, Independent Living and Rehabilitation Research. Grant number 90RT5035. So this is just an acknowledgement I need to make. We are very grateful for the opportunity, grateful to be working with the good folks at VCU, and very grateful to have the NIDILRR funding. And NIDLR is within the Administration for Community Living within the Department of Health and Human Services. Next. So I'm going to talk a little bit about our program of research. And our program of research is called Beyond 90 Days, Quality Employment Throughout the Work Life Cycle. And so the name is simply based on that traditionally a lot of VR programs close cases after 90 days. Someone goes to work, they've been at work for 90 days, and those cases are deemed as successful. And so our focus is much in contrast with the transition to work or the return to work as we are with the entire time frame after which an individual will work with a disability. So we're also concerned about quality employment throughout the work life cycle. And by quality employment, we mean that we need to get beyond simply employment rates, although we're going to talk about rates a lot today. But we need to get beyond this and get to looking at what are really quality indicators. So I'm going to be talking about multiple sclerosis today, but our program also deals with spinal cord injury, and it can be applied to other types of disabling conditions, including TBI, for instance, or epilepsy, amputation, really a full gamut. And again, the focus is on quality outcomes. Thanks. So our purpose today is to identify employment outcomes after multiple sclerosis among a cohort of participants that we identified through a specialty hospital in the southeastern United States. And in this presentation, we emphasize employment outcomes at 3 months, 12 months, and after the diagnosis of MS, as well as at the time of the study, at the time we collected the data. We also emphasize the role of work values and employment. So this is our labor participation model. And I want to go through the various types of variables that we have within our labor participation model. And so this model is something that we have based our research on as we have developed it. So when you think about employment, again, there's a tendency to think about maybe one outcome. Is the individual employed? Well, we look at a whole set of outcomes. So as you look at this figure and you look at the bottom, you can see that that is employment outcome focus, whereas the top of the figure starts with what we call control variables or attributable differences. And what control variables are, they're simply things that we need to account for when we are looking at outcomes. There are things where employment outcomes may vary as a function of these control variables. So things like demographics, gender, race, ethnicity. We have age at injury on this slide. It should be age at diagnosis as applied to MS. And these are things we can't change. And disability largely is something that we cannot change, or at least in terms of a specific intervention for the purposes of employment. For the most part, at least within our research framework, it's something, they are predictors of an outcome. We need to account for them. So if we identify racial ethnic differences in outcomes, then it tells us who we can focus on. So they do direct us to groups or characteristics that of the people that we may need to focus on, but they're not giving us the idea of the types of things that we can change. They're not the focus of interventions. So in contrast to control variables, which are the first part of what we deal with our modeling, the second component are policy-related variables. And policy-related variables does not mean that it is a specific policy we're looking at, but we're looking at things that may become the focus of policy changes or program changes. So when we talk policy, we're talking broadly. So someone may emphasize a certain type of intervention that addresses these sorts of things. And so we are following, again, the model that we've developed and applied to labor participation. And so we look at 4 types of factors within this model, things that may become the focus of change. And they are psychological factors, environmental barriers and supports, behaviors, and health. So psychological factors, personality, not really something that is as likely to change, become the focus of an intervention, but something that has to do with the characteristic of the individual. Work needs and values, vocational preference. We are going to talk a little bit about work needs and values today. We're going to talk a lot about that, actually, and that's just one of the parameters. So behaviorally, what sort of job preparation activities do people do? Do they prepare resumes? Do they search for jobs? So we tend to look at outcomes when we do these studies, but a whole lot has to happen between the time an individual initiates a search for employment or goes through the first chain of events that ultimately we hope lead them to employment and then will allow them to sustain employment. So those fall under the caption of behaviors. Health factors are all the things outside of the functional disability which we look at that certainly may impact employment. And then really environmental barriers and supports. This is something that we talk a lot about in the area of disability because of the importance of things like barriers and facilitators, job accommodations, work assistance, other environmental factors. Rehabilitative services is, of course, a huge factor. And these are all things that, to one degree or another, are within our study, although it would be well beyond the scope of a single webcast to be able to cover all these things, but they will be covered within our efforts to publish the research. And so now when we look at the outcomes, so for the purposes, again, of this model and delineating between different outcomes, so we have broken them down into 2 groups. The first are participation outcomes, and those are things that relate to, has the individual been employed? What's their current employment status? How many hours per week do they work? Have they had job lapses since the onset of the condition? Their total years employed, factors such as these that quantify the amount of work that an individual has done throughout their work life or that they may be doing. And the second set of quality outcomes has to do with things that may either be objective, things that we can define like earnings, job type. Is it a high-skilled job, relatively low-skilled job, type of pay? Are they paid hourly, salaried? How are they paid? Promotions, do they receive promotions? Acknowledgments, awards, and the other is subjective job satisfaction. Next. So as a background with MS, MS affects approximately 2.3 million people worldwide. Most people are diagnosed between the ages of 20 and 50. So this is during what is really the prime of career development. And so it is a very important time. And with a lot of types of disabling conditions, when the onset is within the work age range, then the individuals are going to face certain challenges in attempting to maintain their career, or in the case of different types of disabling conditions, such as a traumatic spinal cord injury or TBI, they may have a lapse in their employment, and it may be not so much of a job retention model as really finding new work. So despite the importance and benefits of employment to quality of life and well-being, people with MS do report some of the highest unemployment rates among individuals with severe and chronic disability. Next. So to get to the background of the current study, and I am going to talk primarily about some certain types of analyses, and I'm going to look a lot at work values, but I just want to outline and provide an overview of the entire study, because this will give you an indication not just of what we're doing today, but of what we will be doing down the line, including at the State of the Science Conference coming up the end of September in Richmond, and also again throughout what will be a lot of publications of various aspects of the data. So we are using a combination of qualitative and quantitative methods. So it is a mixed method study. So the qualitative study has been fully completed. It used open-ended focus groups to identify themes and patterns of employment experience, and that, again, that's complete and been reported in the literature. So we used a qualitative study to get the detailed information on the ideas and thoughts and experiences of people with MS related to employment. And when we get that sort of detail, it gives us the opportunity to identify those themes that we've taken from a very small group of people who have given us that type of detail. And then we measure those themes within the quantitative research with a much larger number of individuals. And that gives us the opportunity to then really come to understand first, from the perspective of the individual with MS, what are those themes? And secondarily, how are they dispersed across a much larger group of people? And also, what are the sorts of factors that are important within those themes? So we are going to focus a lot today on 10 work needs or values, priorities that were identified from the qualitative stage. So in the quantitative stage of research, that is where we obtain the self-report assessments to identify factors that relate to the most successful outcomes. Next slide, please. So this is just a brief summary of the qualitative stage of the study. We had 8 focus groups, 4 to 9 participants each, 74 total participants, which is actually a very strong number for a qualitative group. The average age, 46.79 years, so they were in an age range where people would typically be employed, and the average age at diagnosis was just a little over 34, and so 11 plus years had passed since diagnosis. So again, it's a group that has lived a while with MS, and it has occurred again for these folks within the working age range. So we had semi-structured format lasting 2 or 3 hours. They were long groups. And one of the benefits now of qualitative research that always was a limitation previously is that we have the ability to analyze the data more systematically than simply identifying themes based on impressions from the data, but rather an analysis of the recorded transcripts. And that's what we used, and we used in vivo software. And this is really most all I'm going to say about the qualitative. We did talk about it more during a previous webcast. Next. So then the quantitative methods. And the quantitative methods are, again, self-report assessments. And we collected the data through mail and through web assessments. I use the term self-report assessment a lot rather than survey, because survey implies something that is more of an opinion or attitude, whereas what we look at are people's self-report assessments, and they may be taken in a number of ways. We used mail, and we used, again, web online assessments, but certainly could be done in person as well. So we had a target goal of 1,050 participants, and we currently have exceeded that goal substantially. Now have 1,324 individuals who have responded. We do have some eligibility criteria that sometimes people will, after the fact, need to be eliminated from the study for one reason or another. But our eligibility are 18 plus, less than 65 at the age of diagnosis. So they must have been diagnosed with MS within the working age range, and they must have some physical disability resulting from MS. So those were our criteria for eligibility. Next. So we had, in terms of our self-report assessment, again, everything was based on the labor participation model. We covered a lot of outcome areas, broken down into participation and quality indicators. When developing our self-report assessment, we used items whenever possible that were from national data sets so that the data ultimately could be linked. We have some items that link with a assessment done by Dr. Phil Rumrill, who worked with the MS Society, collected a great deal of data. We have direct comparability to some of that data that will not be reported today, but the notion that the data can be matched and compared with different populations. And we also have a lot of communalities with an independent study of spinal cord injury. And in that study, we have over 2,500 people currently. So again, the focus is throughout the working age range. Next. You can see from the characteristics of the participants that they are similar to the characteristics of the individuals who were in the qualitative study. And age 49 plus, age of diagnosis a little bit older on average, 36 plus, and 12.3 years since diagnosis. Fairly highly educated group, average of 15.2 years. Next. So, okay, the employment rates. And so we asked about employment rates at different points after MS. And so you can see the first point, which is the portion of individuals employed at 3 months post, which was pretty high, still up about 70%. And by 1 year, you can see it drops off below this within our cohort. And then by the current follow-up, it had dropped below 50%. So you can see that there is a decline over time in the employment rate among people with MS. Next. And this is just a summary slide of the income of those who are currently employed. And you can see it's pretty well distributed throughout the income range, with fairly substantial groups of participants at less than 25,000 a year, 25 to 49,000, and a pretty good number, 50 to 70, less than 75. And then you do see some individuals, about 10%, that are all the way at the highest income level. So just in terms of demographics, again, we used a clinical cohort from the Shepherd Center in Atlanta, Georgia, who was one of our primary collaborators. And so it's a clinical cohort. In the sense, so there are folks who were identified who were receiving clinical services. And you can see just under 73% were relapsing, remitting, 7% primary progressive, 8.6% secondary progressive, and 1.7% smallest group progressive relapsing. And then 10% did not know which group they belonged with. Next. So when we look at the employment rate by diagnosis, this first slide is at 3 months post-diagnosis. And with MS, it is of concern, and you need to make a decision as to the timing of when you will use as a cutoff. So we used the time of diagnosis. We asked people to relate back to that time. People typically have symptoms, usually have the disease well before diagnosis. So a lot of things have already been going on by the time they are diagnosed. So it's very different than, say, with traumatic brain injury, for example, when you can say this started at this date, even time of day. So we have chosen to use the time of diagnosis. So at 3 months post-diagnosis, you can see not a lot of differences as a function of diagnosis, specific diagnosis, although the employment rate for progressive relapsing is a bit lower. Next. So as we look at 1 year post-diagnosis, a little bit more of a drop-off in the progressive relapsing, but still fairly similar results. But overall, you can see again the employment rate is dropping. Next. And now you see more substantial declines, and those who are relapsing remitting tended to do better in terms of maintaining the employment rates, but you can see for the other groups they're dropping. And the reason that there is no bar for progressive relapsing is that none of those participants were employed. It was a smaller group, but none of them were employed at follow-up. So just a quick comparison of some of the characteristics of those who are employed, and you can see years of education was consistent throughout the time, not a major factor. It's a major factor in whether people, it is a factor of whether people are able to work, but in terms of at 3 months, 12 months, or currently, not a lot of change. In terms of age, not a lot of differences. And when we say the age is not different, we're talking about the age at the time of the measurement. And so we're just comparing that across the groups. Obviously, people are getting older the longer it is from their MS diagnosis. But in terms of differences between those three groups, we don't see them. And we do see a little bit lower years since diagnosis among those who were able to maintain their employment to the current time. So employment considerations, and now employment considerations also could be described as work needs or work values, what people feel are important that they get from work. And we've asked these whether people are, even if they're unemployed or retired. So we did a first factor analysis of 10 items that were identified from the qualitative themes. So we identified these in our qualitative stages of research, both with MS and SCI, and we applied a principal axis factor analysis with a Verimax rotation and identified factors with eigenvalues greater than 1, just to see if there are underlying themes within the themes. Next. Water, please. So we have 10 items, and so these are themes that came up from the individuals in the qualitative group, and the themes are salary, health insurance, opportunities for advancement, recognition, social connections from work, enjoyment from working, opportunities for helping others, feeling better about oneself, staying busy, and having others share the workload. And again, these were themes. We designed a question for each one of these, and when we did the factor analysis, we had 2 major factors, and I think the first factor, which starts with social connections, is really one that is more defined again by some of the intangibles that people would get from employment, those things that, it feels good to be employed. I want to help people, things along that nature, whereas the second factor is really more about some of the tangible benefits, salary, health insurance, opportunities for advancement. Next. So this table covers, so what do people consider to be most important when you ask them? And if you look at the right 2 columns, you can see that among the employment considerations, that health insurance was number 1 in what people self-acknowledged was important to them. And you'll see that salary is at 34.7%. So people are not overwhelmingly endorsing salary as being extremely important, but it certainly is important based on those responses. We also see things like enjoyment from working, feeling better about oneself, opportunities to help others as being things that people said were extremely important to them in work. Next. So in this slide, what we're looking at are the same ratings of what's important, and basically this is at 3 months post-injury. These are the portion of people who were employed at 3 months post-injury based on how important they said salary was to them. And you can see that those who said salary was extremely important, that was the highest the highest employment rate in response to that. So not only do people say salary is important, but you can see that it is a driver in maintaining work by 3 months. So at 1 year, you can see a similar trend. You can still see differentiation between people who say it's not important and people say it's extremely important. So again, you see nearly 70% of people who say it's extremely important were working, in contrast with maybe mid-50s for people who said it was not important. And then lastly, at the current time, or at the time of assessment, you can see the employment rates as a function of this variable. And you can see that by far the highest rate of employment was among people that said salary was extremely important or very important, whereas those who said it was not important, they were really not really likely to work. So salary, again, is a very important driver, and it is a quality indicator of employment. Next. So health insurance, you see a little bit less differentiation, but still some differentiation between those who say not important and extremely important in terms of the employment rate. Next. That was 3 months. This is at 1 year. And the blue bars, and again, so you see about 50% of the people that said health insurance was not important were working, in contrast with nearly 70 for people that said it was extremely important. So again, not only are people saying these things are important, but they're differentiating the whether people actually will be working at 1 year post-diagnosis. Next. And then lastly, the bars for current at the time of assessment. And again, you see the same general pattern with some differentiation. Next. So in the next few slides, I'm not breaking it down into 3 months, 1 year, and current in terms of animation. I'm just putting them up all at once because you can see as you look at each of these bars. So for 3 months, you see there's very little differentiation in employment rates based on how much people said that opportunities for advancement were important to their careers. So again, we know people have stated this is important. It varies among individuals, but when you actually look at the employment rates, you're not really seeing much differentiation. The same with recognition for performance. You're seeing a little bit of differentiation, but not as substantial. You see where some of the people who had it rated as moderately or very important were not really very different in terms of employment rates than extremely important, and actually in an instance almost was higher, which would we would attribute that to just some of the randomness we see in data, and we don't see a systematic pattern. Next. Same for social connections. So again, something that was stated to be important but doesn't seem to actually be driving people's employment. Next. Enjoyment for working. You can see not much differentiation here. Next. And the same at 1 year, and again. And a little bit more differentiation you see at the follow-up. So at the current follow-up there, you do see a fairly significant differentiation between those who are saying it's not important, where just a little over 20% of those folks are working, compared with 40 plus for those who said it's extremely important. Opportunities for helping others. Again, no differentiation at 3 months or 1 year, but some differentiation when we get to the current employment rate at follow-up. You can see that appears to drive employment at that point with those who say it's extremely important. That's still a relationship with current employment status. Feeling better about self, not much differentiation. Next. And that pattern again throughout, again until we look with some differentiation in current employment. For staying busy, we're not seeing much of anything, so we did not animate that slide. Next. And the same for others share the workload, so next. So those slides were simply, again, intended to say, okay, these are what people say are important. We saw what they ranked as important, but that gave us the opportunity to see how they actually were related to current employment rates among individuals with MS. So employment satisfaction, I want to touch on that next. So in terms of satisfaction with the extent to which individuals felt they were getting what they were valuing at their current job, and you can see when you look at this and when you look at the satisfaction levels compared to the need or emphasis that people placed on these types of work needs, they're very different. So you can see the satisfaction levels with the various areas. There are not many people that are very satisfied with really these 10 areas. The highest rate is health insurance, 25.5%, and then if you combine the satisfied and very satisfied, you'll see that, so approximately in terms of salary, you see about 64% of the people were either satisfied or very satisfied, 62% for benefits. Opportunities for advancement, not so much. So people don't really feel like they are advancing within their employment at the rate that they would like. Recognition for performance, also not real high. Some of the other things appear to be better with social connections, enjoyment from work, opportunities for helping others, and such. Next. So the next thing I'm going to report on is a comparison of satisfaction between item sets. And so we've reclassified the satisfaction as if their score was 1 to 3, either dissatisfied or neutral, we would classify them in one group. And if they were satisfied or very satisfied, classified them in another group. And then what we're going to do is we're going to be comparing that at the time of the MS diagnosis with the current time, and then look to see how does the current satisfaction in these various areas compare with what it was at diagnosis. Next. So the satisfaction with salary was about 10 points higher at the time of diagnosis than at the current time. So people were a little less satisfied with their salary at the current time. Health insurance, similar pattern. You can see that, on the right-hand side, you can see that those about 60% currently satisfied, whereas about 70% were at diagnosis. Satisfaction with opportunities for advancement, lower overall, but again, a similar pattern of about a 10-point difference between the current status and the status of what it was at the time of diagnosis. Recognition, actually even a little greater separation between the time of diagnosis and the current employment. Social connections, again, there's about a 10% decrease from the time of diagnosis to the time of current employment. Enjoyment from working, a little bit of a less of a differentiation. Opportunity for helping others, again, not quite as much of a differentiation. Feeling better about self, still a little bit higher at diagnosis, but not a great deal. Staying busy, similar 10 points. And sharing the workload with others. Again, there does seem to be a consistent difference where there's about a 10-point percentage difference between people reporting satisfaction with those things between the time of the diagnosis and the time of follow-up. So obviously MS presents some challenges within that area, and people have difficulty maintaining the same level. On the other hand, the overall, the differentiation between the two is not great. So people have still a relatively large portion of individuals have maintained their satisfaction in those areas. So what about intentions moving forward? What are people's intentions? So if you look and ask people, and again, we did a factor analysis, which not reporting the detail in the loadings here, but we did a factor analysis of 9 items, and this had to do with people's intentions, future intentions. What are they likely to do? And the first was the first factor, and the first 3 items related to a continuation as to whether they were going to continue the same relative amount of work. And you can see that Very few people thought it was highly likely that they would reduce their workload, about 12%. So some folks having plans to reduce their workload, some, another 28.1% said it is likely that they will do that. So there is, so taken together, that's 40% of the people saying it's likely that they will reduce their workload. Change to less demanding work, a little bit less. So there are about 28% saying that's either likely or highly likely they will do that. In contrast, this next item, continue to work about the same hours, that's turned around in terms of its scale, and you can see in that instance, you can see about 60% of the people would say either they're either likely or highly likely to continue about the same amount of hours. So you see, for the most part, people do appear to be planning to continue the same hours, although there's still, you can see where it is changing for a reasonable portion of people, about 40%, where they are considering there's some reduction in workload. And the next factor had to do with retirement and the likelihood of either voluntary or involuntary retirement as self-defined, or having to retire due to health or disability. And you can see most people don't feel that this is going to be a factor in the immediate future. Only 16.3% said either likely or highly likely to give up employment voluntarily. People did not seem to feel pressured to involuntarily retire, and again, health and disability a factor, but for less than 20% of the people. So going from the first set of findings for factor 1, where there were about 40% of the people said it was likely or highly likely that they might change their work, cut back. When you look at retirement, less than 20% of the people really seem to be contemplating that now. And as far as changing jobs, you do see where there is a little over 30% that said it's either likely or highly likely, and you see another 32% of people saying that they would take on more responsibility, and 34 plus or 35% plus said it's either likely or highly likely that they would have career advancement. So again, putting all those pieces together, there's a group of people that want to reduce their workload or see that as a possibility, maybe about 40% in that range. Less than 20 see the likelihood of retirement voluntarily or involuntarily. And lastly, you do see about 30% of the people that are looking at having some advancement yet. So really on the positive side of some of those things, again, which relate to the quality employment. Next. So what are the implications for VR? So employment rates decreased over time. So there needs to be a focus, particularly with MS, on sustaining employment. So again, whereas with something like spinal cord injury or traumatic brain injury, there is a focus on sustaining employment, staying with a pre-injury employer, but you have a relatively short window. The dynamic of that is a little bit different because there's always an opportunity for people to become employed again. With MS, there's not always going to be disclosure. That's a big issue. There is not necessarily some concrete indicator that someone has MS in the workplace, whereas everyone tends to know when an injury occurs. So there's a different dynamic, and retaining employment becomes an issue. Salary and insurance are the most highly related considerations for employment status, so we need to include the quality of employment to promote employment rates. So also there's times when when we track employment rates over time after disability, they don't change as much as we would like. We would like to have seen more advancement over the last 2 or 3 decades, and sometimes when there's not advancement in employment rates, looking at quality indicators gives us an opportunity to say, okay, if we can't change the number, if we're not going to be successful in changing the number of people who are employed, maybe we can do better with the people that are in terms of their quality of employment, advancement, salary, and things like that. Another point, other considerations like helping others, the intrinsic value, the feeling good about work, they are frequently cited by the individual as important to their work. And so these are all things on an individual basis. Different people have different work needs, work values. We've known that for a long time. And but meeting these needs will not necessarily result in better employment rates. Some of these factors do relate, some don't, but they're not as clearly related overall as salary and benefits, as the tangible things. So sometimes after disability, we seem to expect people to go back to work because it's, for its intrinsic benefits, when there are federal restrictions on what people can make and disincentives. But really we see that salary and benefits, like with everybody else, those are the drivers, that you need those tangible benefits as is fundamental to adult work life. Having job retention will not necessarily result in equal satisfaction, so efforts need to be made to optimize working conditions. So we do see a lag in individuals' satisfaction with different areas of their work life compared to what their needs are. So what they place as greatly important is not necessarily translate into things for which they are highly satisfied. And we also see some declines in satisfaction with most areas, most of the 10 areas, from the time of MS onset to follow-up. And lastly, it is important to consider both job needs and satisfaction with these areas. Next. So what's next? Additional analyses. So the current findings reported that we're reporting today, they barely scratch the surface of the analyses that we'll conduct. We are focused today on certain things, and that's the way we will present the information in the future. We'll take it in chunks and focus on different areas as is necessary to make it reasonable to follow. We will compare several parameters with that of the data collected by Dr. Rumrill, as I alluded to earlier. That'll give us an idea how different things are, the populations are, between the MS Society, which is self-selected, and a clinical population. The findings will be compared with people with SCI using a similar methodology. We have that data. Those things are in progress. And we're in the process of developing a publication that will summarize data on both employment considerations, needs and satisfaction with these areas, emphasizing the discrepancy between the two. So again, a lot of what we talked about today. And multiple quality indicators will be the focus of econometric modeling, including both those indicators of employment participation and employment quality, the subjective evaluations of employment over the work life cycle. So we didn't do any econometric modeling for this, but we'll be able to attach different probabilities to different outcomes. Next. So future research, additional research beyond data we've collected, need to break down, do a better job breaking down disability research in the future, and we will do some comparisons with larger national surveys of employment. So actually when I say better breakdown of disability, those national surveys used a handful of 7 or 8 items to identify disability. They're very general questions. And when we do this types of studies we're doing now with MS or spinal cord injury, we get much more detailed information on diagnoses. So you can see, even with what we presented today, considerable differences by type of MS. So although it's very important to track general trends in employment outcomes related to physical disability, those measurements in those national studies can only be very limited and very global in their findings, whereas we need to utilize these opportunities of having the greater diagnostic information. We need more of these types of data collection, the type where we get this level of detail, because you just won't have the diversity of outcomes in those national data sets to study quality outcomes. We need to have longitudinal follow-ups. So the current study and our parallel SCI study, they are not longitudinal or cross-sectional yet. We clearly need longitudinal studies. So we followed people to the current status. We've seen declines. We've seen people saying they're going to cut back on their hours. Others worried about retirement, and others on the other side that are still moving up the employment ladder. So we need to follow up to see how much people are able to do that and why, and that will help us to design some programs to help promote these outcomes. We need this quality employment model and apply it to other conditions. So this is MS, we're doing it with SCI, but clearly what we find will generalize to a large degree to other groups, but we need to study those groups. And then lastly, and always, we need intervention studies to improve outcomes. So I'd like to thank anybody that is listening to the webcast. I hope that it's provided useful information. Clearly, again, it's just the tip of the iceberg of what's coming out of this research and coming out of the Research and Training Center on Employment at VCU. We're very proud of the work. We have a great team of people that are working on this study. We feel very fortunate to be able to collaborate with the people at VCU. They are outstanding, and together we're working to find the answers to some of the issues that can help us to enhance the employment outcomes of people with physical disabilities. And the contact information, if you want to contact us, it is available here. Thank you.